Dr. Jayanta Datta, consultant physician and head Department of Internal Medicine, Charnock Hospital, Kolkata. What I am going to discuss with you today is a few little things about the disease which is very much prevalent in the city now, that is dengue. Dengue, as we all know, is a viral disease which is a vector-borne. That means a vector that is Egypt mosquito, it transmits the virus of the disease. So humans get infected by the bite of the infected mosquitoes. So generally, when does it occur? Dengue happens, the incidences of dengue increases particularly during the rainy season or just after the rainy season every year. And what are the symptoms of dengue? We should all be aware of. The commonest symptoms of dengue is just like any other viral fever, that is high degree fever with chills and rigors, severe body ache, sometimes skin rashes, severe backache, headache, muscle pain, joint pain, and retroorbital pain, that means pain around the eyes or behind the eyes. So these are the commonest symptoms. Apart from this, there are some other symptoms which are not very common, but these are relatively more dangerous symptoms. Like when the patient develops some kind of confusional state, so when patient goes into drowsiness, or patient sometimes develops seizures, or patient can complain of severe pain abdomen or abdominal distension. These are the more severe symptoms. Along with that, there can be some skin bleeding from nose, bleeding from rectum or other sides of the body. So these are all very critical or dangerous symptoms of dengue. Now, who are the patients who are most vulnerable in dengue, or what are the phases of dengue? Generally, dengue happens in two phases. The first week is, that is between 2 to 7 days, is a kind of febrile period. That means the patient is going to develop high grade fever during that part. After that, in the second week, the fever subsides, but the few of the patients develop complications, though the number is very few. And complications one has to be very, very aware of is that there are two kinds of complications. One is fall in blood pressure giving rise to shock, that is known as dengue shock syndrome, and another is dengue hemorrhagic fever. That means there are hemorrhage from various sides of the body or skin, or from the nose, from the mouth, from the rectum, from the urethra, so on and so forth. So the second week is very crucial. Once the patient passes 10-14 days after the onset of fever, then most of the patients are cured. So generally, the complications does not occur in normal people. Most of the healthy people, they survive the episodes of dengue. But some of the patient groups, they are more likely to develop complications, like the pregnant patients, like patients who are quite young, pediatric age group, or patients who are quite old, like geriatric age group, and the patients with heart ailments, kidney failure, liver failure. These patients are more susceptible to dengue. Now, how do you treat dengue? Dengue does not have any specific antiviral or antibiotic drug. So most of the time it is treated symptomatically, like with IV fluids, with rehydrations, or with the paracetamol, and sometimes with the vitamin tablets for control of weakness. And most of the patients respond to that kind of treatment. But few of the patients, they need hospitalizations, like if the patient develops some kind of fall in blood pressure, some kind of altered sensorium, some kind of organ failure like kidney or liver failure. So patient has to be admitted and treated accordingly. So how can we prevent dengue? That is very important for the society or for all of us to know. Dengue generally happens from the mosquito bites, and these mosquitoes, they develop in waterlogged areas around our household. These are the mosquitoes which breed in our households, like in a plant pots, like in old tires, some like old utensils, some bathroom items where you keep your water for some few days, and the dengue mosquito larvae grow there. So you have to stop allowing accumulation of water in around your household. Number one, you should go for cleanliness of the household. You should prevent mosquito bites by wearing full sleeve shirts, or sometimes using mosquito repellent if you feel like there is a chance of mosquito bites. So this way you prevent the mosquito bites, and you prevent the mosquito breeding, and you prevent the dengue. So that's all for today. Thank you very much for your hearing.